There are three facial soft tissue spaces in the midcheek. The preseptal and the prezygomatic spaces have been well described. The third space, the premaxillary space, is the focus of this dissection. An incision is made through the skin in the orbicularis oculi. The preseptal space is entered and developed bluntly to its boundaries. Inferiorly, it is bounded by the tear trough ligament medially and the orbicularis retaining ligament laterally. The orbicular origin and retaining ligament are not located at the orbital rim, but several millimeters below it. It is a mean of 2 mm below the rim medially, 6 mm at the mid-pupil line, and 5 mm laterally. An incision is made down to the bone along the nasal sidewall. The skin is then tented up. The premaxillary space is then bluntly entered through its medial boundary. A branch of the infraorbital nerve is seen in the medial boundary of the premaxillary space. The levator labii superioris is seen in the floor of the premaxillary space. The origin of the orbicularis oculi in the tear trough ligament forms its superior boundary. A large branch of the infraorbital nerve is consistently seen in the lateral boundary of the premaxillary space. To give better visualization of the lateral boundary, the roof of the premaxillary space is then cut. Further dissection clearly demonstrates the nerve as well as multiple smaller facial nerve branches located here. The levator labii superioris is transected, revealing that the nerve is indeed a branch of the infraorbital nerve. The upper boundary of the premaxillary space is tented up by skin hooks. The origins of the palpebral and orbital parts of the orbicularis oculi are then bluntly separated from the tear trough ligament. The origin of the orbicularis oculi is then divided, isolating the tear trough ligament. This osteocutaneous ligament is extremely strong. At this point, the course and relations of the angular vein can be clearly visualized. The angular vein is consistently located in the lateral boundary of the premaxillary space, where it is located lateral to the branch of the infraorbital nerve. Upon reaching the upper boundary of the premaxillary space, the angular vein turns acutely and is closely associated with the origins of the orbital part of the orbicularis oculi. The inferior boundary of the premaxillary space is formed by the maxillary ligaments. Viewed from the top, the infraorbital nerve can be seen to exit the infraorbital foramen, run under the levator labii superioris, and transition to the superficial fascia in close association with maxillary ligaments. Turning to the prezygomatic space, an incision is made through the skin in orbicularis oculi. The prezygomatic space is then entered and developed bluntly. Like the levator labii, which forms the floor of the prezygomatic space, the zygomaticus major and zygomaticus minor is located in the floor of the prezygomatic space. Traction on the muscle elevates the mouth, confirming it to be the zygomaticus major. As described previously, the upper boundary of the prezygomatic space is formed by the bilamellar orbicularis retaining ligament with the zygomatical facial nerve closely associated with the lower lamella of the ORL. This is the lower lamella and upper lamella of the ORL, respectively. Changing our perspective to viewing from the premaxillary space, the premaxillary space is separated from the prezygomatic space more laterally by an area of loose areolar tissue and can be easily connected by blunt dissection. As demonstrated in the dissection, the premaxillary space is anatomically analogous to the prezygomatic space located lateral to it. Like the prezygomatic space, therefore, it is a true facial soft tissue space.